Folks, thanks for coming on with us today. My name's John Dubas with Premier Marketing, and we'll be spending the next 45 minutes to an hour or so discussing some of the ways that you can determine a roadmap for selling Medicare supplement programs and cross-selling additional programs as well. We'll discuss the tools that are available through our organization to do so and the choices that you have with some of the different carriers that might be a good option for you in your target markets. Today's presentation is being recorded, and it, along with much of the material that we'll allude to through the course of the presentation, will be sent by email in follow-up to all who have RSVP'd for today's presentation. We thank you for coming on the line and investing your time with us today, and invite you to use the system to put in any questions that you may have about the presentation or the services that we offer moving forward. In a bit of housekeeping, a bit of information about our organization to start. Premier Marketing is a national marketing organization founded in 1968. We're part of the Integrity Marketing Platform with offices across the country. And we act as an insurance wholesaler in conjunction with the independent insurance agents that contract with us for the programs that are offered. Those contracts are available at the highest possible commission levels, and recruiting contracts are available to those who qualify. As I mentioned, we were founded in 1968, so that means we've recently experienced a milestone in our history, a 50th anniversary. It's quite an accomplishment for an organization that started as a small family agency in rural Nebraska that's grown into one of the largest marketing organizations of Medicare product and ancillary programs in the country. We do so through a full portfolio of product, including the Medicare programs necessary for our beneficiaries, and those include those Medicare Advantage and Medicare Supplement programs, the standalone Part D prescription drug plans, life insurance and annuity programs, including final expense and life insurance and pre-need programs, long and short-term care plans, disability income programs, and ancillary benefits that include dental, vision, and hearing plans, critical illness and cancer programs, and hospital indemnity programs. Those Medicare Advantage programs include all the national carriers and many of the strong regional carriers that make a difference for you in your market. And that same philosophy carries over into the standalone PDP portfolio, where the national carriers are there for your use through our organization. The Medicare Supplement portfolio that we offer is very robust and large, and we have specific marketing programs in place that can help this be a very successful part of your agency. The ancillary products, well, in each of those categories, the leaders are there for you and make very solid choices for your prospects and clients in covering the gaps that aren't covered by the base medical coverages. When we look at the Medicare market overall, of course, you don't come on a program like this without someone speaking to the aging of the baby boomers, 10,000 people a day turning 65, and how that's an incredible opportunity. And it's all well and good when you consider Medicare as an opportunity for us as agents, as daytime activity, people who are serious about our services, a number of other demographics that make this market particularly appealing outside of the sheer size. But if you look at it just based on age, well, it's not a true indicator of that market, because some people turn 65, don't access their Medicare benefits, and about a sixth of the Medicare population is actually under the age of 65, medically disabled, and are in need of our services as well. So that makes for a very diverse population where the folks we speak with have some challenges with their health, and sometimes have some challenges with their market, with their wallet as well. So that necessitates a strong portfolio of products for us to use in dealing with our prospects and clients, because those folks really have a need for a choice in the programs that they're being offered. Because, well, when you look at this particular graphic, you've got 2/3 of the population with 3+ chronic conditions. Almost a quarter of the population has 5+ chronic conditions. So we need to be prepared in dealing with the folks we visit with and to address the challenges they have with paying for some of this coverage as well. Because obviously they have choices as they go into the Medicare program. And the first choice is not to make a choice at all. They don't have to do anything. In a manner of speaking, they can actually even decline the Part B coverage, which can make life interesting for them and us down the road. Most folks, however, have the A and B coverages when they work into the Medicare situation, and then pick up just a standalone Part D program for their medications. Or they may choose to utilize one of the carriers offering the standardized, modernized Medicare supplement programs, and with the changes being brought about by MACRA now, well, some differing changes in the options that they have available. Some folks might find that the Part C programs, the Medicare Advantage programs, may be in their best interest. It's up to us to help make certain they have the information they need to make the choices that are necessary, and that's part of following the roadmap that we have for Medicare sales overall. Many of us as agents will have our own favorite program as well. There are a number of folks out there that market just Medigap policies. Some folks that are only on the Part C markets. Some folks that do everything. One of the things that I would ask you to do is to keep an open mind for some of the different possibilities and see how that might give you more options, not only to better serve your prospects and clients, but also aid you financially. Because the people that are coming into Medicare are making pretty much an even split as to what they're going to do. About half of the folks that are making a choice choose a Medicare Advantage program, another half the MA program. There is that pocket that's not choosing to do anything at all outside of original Medicare. That might be because they have additional assistance one way or another through perhaps a Medicaid program or being a veteran or having a retirement program. There's a number of reasons why someone may not utilize the programs where the majority of people are looking at. So some different things we have to be aware of is the conversations that we have with our prospects and clients and see what information we can get to them to help them make the best choice for them. And we have certain times in which to do it. And one of the upcoming webinars we have deals with the different steps, special election periods, and opportunities to change. So we're not going to go into great detail with that right now, but we are in that OEP period where the Medicare Advantage people can change from one Medicare Advantage program to another, or they can withdraw from a Medicare Advantage program, go back to traditional Medicare, and have a choice at that particular point in time of picking up a Part D program to make certain that their drugs are covered, and then look at other healthcare coverages, an opportunity for Medicare supplements for those who have decided for one reason or another that an MA program wasn't their best choice. And you obviously have other reasons why someone can change from a Medicare Advantage program moving forward as well through the different special election periods that are made available to them. As I mentioned before, we're going to do a webinar specifically on these opportunities next week, so we're going to move past them now. We also have to be aware in our situation in marketing Medicare supplement programs that the MACRA legislation passed clear back in 2015 finally came into effect the first of this year, and it is making some choices different for different people. It's important to note that some of these programs are not going away for everyone, but those choices may be limited for the newly eligible. We have additional information for you on the Medicare Access and Chip Reauthorization Act of 2015, and that will come as part of the follow-up to today's presentation as well. This slide gives you a bit of information as to how those different plan types within Medicare supplement programs are made available to the population. And this, along with the other information that we're referencing, will be coming to you as part of the follow-up to the presentation. So the base programs in the Medicare supplement world don't change for those folks that had already been on Medicare before the end of 2019. It's just moving forward for the newly eligible in 2020, where the Medicare supplement plan types those options change for those individuals. So let's spend some time looking at how we can specifically address selling additional Medicare supplements or Medicare supplements in general, and some additional programs that are necessary to make certain that we cover the needs of our prospects and clients, regardless of whether or not that service is covered by Medicare itself. Because we have to remember, for a Medicare supplement to help an individual, that base coverage has to be covered by Medicare to begin with. So we need to look at some of the tools that are made available to us as agents contracted with Premier Marketing. And one of those things that comes as a freebie, in a manner of speaking, are the quote engines that are available to you through our organization. We do contract with CSG for use of their services, and it gives us the opportunity to go into a quoting system that enables us to offer additional information to our prospects and clients through a complimentary Medicare supplement review. But it also gives us the opportunity ahead of time to make certain that we have the programs in place that can make a difference in our market. So we go to the quote engine, we log in, we look at the different programs that are made available, and this gives you the first insight as to, wow, this is beyond a Medicare supplement tool. And that is very true in the fact that it gives you the opportunity to look at additional product beyond Medicare supplements. And I know some of you may be thinking, well, I'm on this to listen about Medicare supplements to start with. We're going to get to that specifically and address it. But if you look at this, it gives you the opportunity to not only sell med supps, but also get additional information to do things electronically through the e-app function, through the storage of the scope of appointment. I know it's not required for a Medicare supplement, but utilizing that tool regardless can give you the opportunity to make certain that, well, we're going in for a med sup, they're going to want to talk about a PDP as well. I may or may not offer that, but let's make certain that I stay compliant and set expectations, because those generic scope of appointments list a number of different types of products, including dental programs and hospital indemnity programs that can be sold even on an initial appointment for an MA program. MedSup regulated differently, I understand, but it sets up a conversation about additional programs as well. It also gives us the opportunity that as we go in and we visit with people, and let's say we're in a market that's dominated by a Medicare Advantage program or programs, it gives us the opportunity, if that person decides that that's going to continue to be their best offer or offering for medical coverage moving forward, we can utilize this tool to cross-sell. By selecting the Medicare Advantage program that they're on, it gives us an option to fill those holes. So those hospital daily co-payments can be filled with a HIP program under these programs from a number of different carriers. So you're not just looking at one particular company. You can do that in many circumstances with the carrier software. This gives you the opportunity to do so and look at a number of different carriers for a hospital indemnity program, or perhaps adding in some dental coverage, because even Medicare Advantage programs that have dental coverage, it's not always all that extensive, and in certain circumstances may only help with preventative care in certain markets. So this gives us the option of going through and showing specifics on those different coverages to make them work for us. It gives us then the opportunity to quote Medicare supplements specifically, and bear with me because we're going to do a live demonstration in a moment specifically for that. But it also gives us then that opportunity to get that information about a specific Medicare Advantage or standalone drug program that they're on, so we can augment that coverage, and gives us the opportunity to do some of that coverage electronically through apps that are giving us the opportunity to enroll in the different programs, moving through this software program by itself. It also gives us an opportunity to discuss final expense insurance as a follow-up to our main presentation. If we're going in with an open door through a Medicare discussion, moving forward, you can do a presentation on final expense on a Medicare Supplement presentation, but not on a Medicare Advantage or PDP presentation in that same meeting. Remember that. It's a non-health type of program, so you've got that 48-hour cooling off period that you have to deal with then as well. In many circumstances, that can work to our advantage because it gives us the opportunity to prepare ahead of time with different levels and get our duckies in a row to make certain that that presentation is effective for us. Once again, an opportunity to go in and show those hospital indemnity programs to cover those daily co-payments during a hospital stay and other things, and the dental coverage that so many people are interested in and need as well. And bear with me, I'm seeing some people are not getting the full picture of this. Hopefully that adjusted it. You don't need just that picture of my face. That's most certainly true. So, and the slides are going to come to you as well, along with the recording. And it is showing it on the recording too. One of the things that the quoting tool also does for you is give you the opportunity to obtain that electronic scope of appointment, that scope of appointment through an electronic means, and store it for that required 10-year period as well. So it is one of those things that regardless of whether or not you sell a Medicare Advantage or PDP program on an appointment, if you're talking about it during the course of a presentation with Medicare Supplements, you need that scope and you need it stored for that 10-year period. So let's look at some specifics on the quoting tool and how it can work for you. So as you go to the website and you get to the quoting tool, it gives you the opportunity to obviously request access to the tool if you don't already have it. That can happen for you very quickly through the request account piece of it, and go in and sign in. If you have registered for the tool with us or perhaps another organization and you've forgotten your password, it gives you the opportunity to go in and update that and access the tool easily and quickly and without cost in this particular circumstance. So as we sign in, we hear that Jeopardy theme in the background, and then boom, it gives us the options that we have within this tool. When we speak of Medicare Supplements, boy, this is a complicated one to run. Boom, you hit that button, you figure out where you're going. Let's use this zip code as a sample, and it'll give you then the opportunity to adjust the age. Let's do so. The effective date, first of next month. We're going to look at, well, since this person is 67, they have the opportunity to still price quote an additional F plan. Let's do that. And let's see. Still non-tobacco user. We're going to start out without the household discount in this particular circumstance. And for those of you who are accessing the webinar itself and you're looking for a specific example in your market, don't be afraid in the questions section to pop in a zip code so we can have that work for you as well. So we set this up. Let's look at the programs that are available through our organization in this tool. Run the quote. It's thinking, setting it up, and it lays out different carriers that are available to you in your market through our organization. And it gives us then an opportunity to assess our own marketing strategy to best address the customers we deal with. And so that means, wow, do I want to contract with 900 different Medicare supplement programs? Probably not. Well, for one thing, there aren't 900 of them in this particular zip code. This is Louisville, Texas, suburb of Dallas, just north of it. And it gives us then an opportunity to look at some different things across the board, including the price, if the program has a policy fee, if there is a household discount. One of the things it also does for us is allows us to get some additional marketing analytics, which is really helpful for us when we look at the different Medicare supplements that are available to us. One of the things it does is open a discussion between us and our prospects and clients as to, okay, we've determined that a program that doesn't have a network attached to it as a probable best choice for you in your situation for health coverage moving forward. And since it's a Medicare supplement program, in most markets, there are some states that have different regulations, of course, we can apply for coverage any month we choose to do so. We just have to qualify medically for that coverage. This then tells us that, okay, some of the different choices between the carriers, since a Plan F is a Plan F is a Plan F, well, are there some additional things that are factored on beyond the standardized benefits? And why is one program cheaper than another? And it gives us then an opportunity to discuss those different programs and what comes into play that way. One of the things that doesn't come into play in this circumstance through the tool itself are some of the reasons why we would want to contract with them. We'll go into that in just a minute and what goes into that. But in these circumstances, we see that the least expensive carrier in this particular zip code is the B++ program. Still a decent rating. We haven't had challenges very often with Medicare supplement programs and the financial stability, but it then gives us an idea as to what happens to that premium as we age as a policyholder. We see in this particular circumstance that this carrier bans annually, and so we can anticipate an increase in the premium based on us getting older as a policyholder in that play. It also gives us the indication of what are some of the standardized increases or the increases laid out by the carrier on the business that they're underwriting. They can't go in these circumstances and increase just a single policyholder's premium. They're going to look at it by class, but we can see in this circumstance that it's a very nominal increase in premium, particularly when you consider that the medical trend in our country when it comes to addressing different cost of care is much higher in many circumstances than single-digit increases. It also tells us that this company has a pretty sizable book of business, and that gives us an indication in many circumstances of how stability of those premiums can be foreseen moving forward. It also tells us as we roll through things that there are a number of companies that are the big name carriers. And in many circumstances, you'll want them in your pocket because some people are comfortable with a name that they recognize. And in many circumstances, they'll pay more for a program who has that recognition within their mindset within a certain degree. So that gives us then an opportunity to make certain that some of the folks that we may use for other programs, including their Medicare Advantage or standalone drug plans, their PDP programs, need to be a part of our program. It gives us then the opportunity to say that, okay, I need an inexpensive program for those folks that just want what's the cheapest. I also need some programs that come into play for those folks that are looking for a name that they recognize. I also would want to take advantage of a company that has a broad portfolio, perhaps through a singular contract. Many of the companies will have separate contracts for Medicare Advantage PDP and then for any type of ancillary benefits or perhaps the med sups themselves. Some of the carriers will put it all into a single contract. But that then gives us the opportunity to examine these companies for our usage as well as to what type of marketing support do they lend us, what type of electronic tools do they have, or other means of getting in front of folks to make marketing the programs simpler. And then what all do I need? Remember, you can eat the elephant a bite at one time in this circumstance, because of all the Medicare supplement programs, only one requires any sort of certification. And in many circumstances, these contracts will process more quickly than a Medicare Advantage program that requires some of the additional effort in order to get the contract through the systems. Some of these also will look at your background differently than others, where some will look at credit more stringently than some of the others, and then some of the companies will also look at, well, it's all part of one contract, and I have certain limitations when it comes to how I use the name of those programs. And are there additional kind of frequent flyer programs that come with these, and what benefits do I get with them? When you look at the size of some of these companies, well, here's a very stringent or very evident illustration of that. You can see the difference in the size of the book. And in many circumstances, that allows for a lower increase in a premium because they're able to withstand claims perhaps a bit easier. You also have within some of these organizations specific marketing programs that can be very helpful for you. For example, here, the offering by America, the Great Southern Life Insurance Company, they have a unique social media support program that can be very helpful for you in marketing through Facebook or other social media means to get in front of people to have prospects to sell. You have within the AARP program, their Authorized to Offer program that gives you access to additional, not only compensation, because they have different bonus programs that way, but also the use of their logo that you wouldn't in other circumstances, and other tools brought about by that organization. You'll also find that some of these companies will have more field support for you than some of the others, and that can make a difference as well. So depending upon a particular market that you're in, a selection of these programs is always good, and you'll find that many of these programs have different marketing allowances, bonuses for sales in a manner of speaking. Some of them starting at the very first app that's written. Some require 3 to 5 a month in order for those additional monies to be paid for you. But those funds are sent to you in addition to the commission that you earn as well. So working through your particular market with this tool can make a big difference. One of the things that you'll see as well is many of these companies will handle different health circumstances differently than perhaps their neighbor on the same quoting tool. And this gives you the option of putting in some additional underwriting constraints that can give you a strong carrier to sell for a particular client. Because why would you want to tease someone with the least expensive premium that's out there when you know they're not going to qualify for it? And that brings us to a need for a couple of the carriers who perhaps have more lax underwriting requirements, and those are those are organizations we need in our pocket in order to make it work in the market at large. So you've got a number of different pieces that can come into play here that can make it available to you. You obviously can use this tool on a live basis. If you're in a house with an internet connection, use this just as what we're demonstrating here with different tools that are available. You have to be prepared in those circumstances to explain the differences between the programs and the fact that you may or may not be contracted with every one of them, obviously. But you also will want to make some of this material available if you're in a home that doesn't have Wi-Fi, or you don't have a hotspot that you can access the internet in a spot. So you can actually download these quotes and have them available not only for a file that you keep on your prospects and clients, but also as a sales tool to go through and visit with the individual with this information prepared ahead of time. It gives you the opportunity then to have a piece that you can leave behind as well. Sometimes too much information left behind, though, can render paralysis by analysis, and you can get some back and forth on it that, quite frankly, can hinder the sales process and the close altogether. We can give you some different discussion points, however. One of the things that you can do as well, though, is pick just specific carriers and do a side-by-side presentation, and that works really well as well. This particular tool component of downloading to the Excel format gives you the opportunity for your files to really be prepared not only with different carrier information, but different plan type information as well. You can go in here and change the plan in a live demonstration from an F to a G to an N, or whatever you choose to show. This, as it downloads, will have that information available to you across the board for all the carriers in that zip code, for all the plan types that are available there as well. Take a peek at that. Let it think a minute. Oops. Someone's been doing some webinars, haven't they? And this tells us the different plan types and what's available. So it lays it out side by side, a true documentation piece for you to use and have available. One of the things you can do as well as you're in a home with this tool is go from plan type to plan type for that same individual. And you can see that an F is $125.98 with the least expensive plan. As it thinks through and pulls up the F for us, it's going to tell us that, okay, an F was $128, a G is $99. And that difference of $29 a month over the course of a year is obviously in excess of that Part B deductible, which is the biggest difference, well, the difference between those two programs, and how an explanation of that can help you with additional sales as well, rather graphically, because the 28 by the 12 is much more than that Part B deductible. It also gives you then the opportunity to go in and add different discounts as well. So if you are in the house looking to present to just the husband or the wife, it gives you the opportunity then to add on the household discount and how it can pull down the premiums even more. Some of these carriers will allow a household discount without two policy holders in the household. Some do not. So it is a necessity for us to make certain that we know what is available with a particular carrier when it comes to this discount structure and how it can affect our approach moving forward. Some of the other things that we need to see here is, of course, you can switch to different plan types. And let's say we've gone in and we've done a discussion on a Medicare supplement program. They decide, boy, I like the program, I just don't like that premium. Do you have anything different from that? And since they're the one bringing it up, it then gives us the opportunity that if we haven't already done so, we obtain a signed scope of appointment and we look at some of the other coverages that are there. It gives us then the opportunity to go into other types of programs and the different types that are available there. Let's run a quote, let it think about it, and it'll give us the information of all the plan types that are available there based on premium and assort in this particular circumstance. This then creates an entirely different presentation where we need to go through and discuss not only the benefits that are part of that program, the costs that are part of that program, but also the network requirements. And in many circumstances, if we have an area that's dominated by one program and they're happy with it and the network, they'll be placated by just that, but it gives us then that opportunity to go in there, select the program, and fill in the gaps based on that benefit structure. And okay, here's a hospital indemnity program that will help you with that maximum out of pocket and the dollars that are necessary when you are part of the benefits that are laid out with that plan. So some different things that come into play there. And then, of course, the discussions that are brought about by some of the lack of coverage within the Medicare world, and we see that quite frequently within the dental world. Even the Medicare Advantage programs, well, there's not always a lot of dental coverage with them as well. And so we need to make certain that we can speak to a standalone dental program, which most commonly is paid on an indemnity basis, that allows that coverage to come into play regardless of whether or not any other coverage is already in force. And it gives us premiums based on, basically they're starting out with pure minimum coverage, pure minimum premium, but it gives us then, wow, a vision program or whatever else that is part of the opportunities within that carrier's offerings. So we've got some different things here that can help with not only you preparing for what you need as part of your portfolio, but as a presentation tool, either live or prepared ahead of time for your prospects and clients. These programs are available to agents contracted with our organization and downline organizations as well. So if you contract with another organization that we work with, we need to speak with that organization as to making this available to you. It's not a challenge, it's just making certain that we have our ducks in a row and get it together for you. So that does also allow you to, on the Medicare Supplement programs, this slide reminds me, thank you, John. We go back into the Med Sups. We'll do this real quick without changing some of these other parameters. We're seeing a ever increasing number of individuals or individual carriers that have software programs that help us as well. But this then gives us the opportunity to access some of the electronic tools that are available to you through them, all through one particular tool. So you'll see different resources made available for the different carriers, and it'll give you either access to the application within this tool itself or send you to that carrier's website to use the tool that comes as part of it. And you'll see too that some of the carriers will actually make the PDP of the paper application available through the tool because there are some folks that, hey, I'm still a paper guy. I'm still a paper gal. I need that information, and this will help you with that. Great way to make certain that you have all the apps that you need as part of your presentation as well. Some of the other things we've got to keep in mind, however, is that we don't always want to put all our eggs in one basket, and one size doesn't always fit all. So as we work with different tools, there's been a lot of talk this past AEP and moving forward of the Medicare Plan Finder itself and some of the changes that were brought about by the government in that tool and some of the improvements and challenges within that. So utilizing that tool is a great way of accessing additional information from a governmental source. One of the challenges we see with a Medicare Plan Finder itself is the comparison between an MA plan and a PDP program can be a challenge, and it doesn't work all that well if you're just comparing one Medicare supplement carrier or plan to another. So you have some different things that can come into play. We can help with the tool we just demonstrated. As you get into the Medicare Advantage piece of it, our Medicare Center program is a great way for you to do compliant comparisons between MA and PDP programs. It too is available without cost to our contracted agents and made available to you. We just need to make certain that the contracts are in place for that valid comparison. And one of the things that we keep speaking to when we talk about cross-selling and additional tools, it's not just making it easier to sell, it's doing what's right for our prospect and client, because we're covering those gaps that Medicare doesn't cover. I mean, then that goes beyond, okay, I've got a Part B deductible on a G plan I got to speak to. Yeah, or I have the hospital copayment in a Medicare Advantage program. Outside of just the basic blocking and tackling of such coverages as that, we also need to make certain that our folks realize that, hey, long-term care isn't covered in a Medicare payment structure. You have to have additional coverages to make that work. Or, boy, you're looking for help with your teeth? Well, MedSups don't offer that. Some of them will have an add-on type of discount program, perhaps for dental. They don't have dental coverage. So it gives us that opportunity to discuss that, the different things that come into play. Also, when we talk about final expense, you'll see the different marketing tools put out there by different companies that work in that field that speak to the $255 benefit with Social Security. Get much beyond that, you don't have help. You need additional life insurance through a final expense policy or another means to cover that. But as we get beyond that, one of the things that we see is the more policies that we have in a household, the better off we are as agents, and it lends for increased persistency within the household too. Those folks are more mindful of the fact that, hey, I've got my business with Agent Josephine Smith. She takes care of me. I want to make certain that my policies stay in play. And the more policies you have in the household, the higher your retention is with those policies across the board. They don't even have to be all with the same company, different types with different organizations. You have more than one policy in a household, your retention, your persistency is driven up by those numbers of policies that are available to you. What you have with us as well is some additional support beyond these systems that can help you determine what you need and how you can sell it. And it goes into a way of contracting with multiple carriers simply through creating an agent profile, insurance pay, and contracting with carriers that participate in that system electronically. So you don't have to fill out a paper contract with everybody that you wish to contract with. Lord knows there's a whole bunch of choices for you to do so. Utilizing this can minimize some of that paper that can be a challenge for us on a day-to-day basis. And as an independent agent, you need to make certain that you cover your TOOCUS financially. Errors and admissions coverage is a common requirement with most of the carriers. This is a program that can cover you across the board with whatever carrier that you contract with and through whatever marketing organization that you work with. We realize that as an independent agent, you have choices, and some of those choices may be because, well, boy, I love working with these guys, but they don't offer this program, or I don't want to put all my eggs in a contracting situation in a single basket either. Regardless, this is going to give you the E&O coverage to help with whomever you contract with and through whom. We also make certain that we help you keep your license in play through bundled discounted continuing education packages through our affiliation with WebCE. And as an independent agent, you create your own benefit structure as well. So we have available for you through a modified guarantee issue basis at discounted rates where you share in the commission, disability income insurance. It's non-cancelable and on an individual basis. That's made available to you as well. We do a number of these informational webinars and we record them, much as what we're doing today. And you can access the past ones that are done and completed and accessible through our website at premiersmi.com or on our YouTube channel. It doesn't speak to just product or a particular carrier. There are different marketing programs that come into play that are available to you through these recordings as well. And once again, keep in mind that the tool that we discussed today, the quote engine, is available without cost to agents that contract with our organization and gives you then the opportunity to plan ahead and realize that you can cross-sell simply with this tool with just utilizing the components that are within it, and do so on an electronic basis as well. That Medicare Center program, of course, is available to you as well for the MA and PDP programs. It's also a great tool that many of our agents use as a CRM and gives you the opportunity to cross-sell out of it. Because in many circumstances, some of the folks that you quoted with that tool, well, maybe they didn't buy from you. Maybe they didn't want an MA program and they will look for a Medicare supplement choice down the road as well. You can use the information that you stored within that program to help market efficiently that way as well. You can also have a program that will put your social media marketing on AutoPilot through our Coverage Made Easy program, and realize that one of the choices that will influence you when it comes to the companies you contract with may be additional incentives. This portion of our website puts all that information together for you so you can look at the different trips and incentives that are available, not only through the different carriers, but how those also help you qualify for the Premier Producers Convention as well, which this year is a cruise from Miami to the Bahamas. So if you're one of those sun worshipers, this was one to get in on. Our cruise, or pardon me, our trip for next year is about to be announced, so look for that information coming very quickly. You also have an opportunity here to get some additional lead support. The contact lists that are available to those folks who still like to smile and dial. It's not dead. Many people still do that. Give you an opportunity to get that list bumped up against do not call, with or without numbers. If you want to use it as a basis for a mailing, that's available to you at a discounted rate or at no cost at all. And we also help you work through different community-based programs that can put you in front of the buying public as well. Believe it or not, many people are still in Walmarts. Even after AEP, they allowed continuation for agents working those moving forward. We also have a system to set up for you in working with centers of influence in the community, including the powerful influencer of faith-based organizations, a way for you to address the needs on either camping at such organizations or through seminar selling. We also have systems that come into play for marketing with providers, not just contracted medical providers within an MA program. Also look at the folks that deliver care on the other programs that we offer, like dentists, or working with home health carriers, because we have, those short-term programs that can help with that cost as well. And many of the carriers also generate leads that they work with agents who are true partners to their organization. And some of them offer some pretty unique marketing assistance, even beyond general lead programs of that sort. Mutual of Omaha is a really cool marketing support program that allows you to use those credits for things beyond just mailings and some of the other things that come into play. We have introduced internet leads. We're working with a number of Facebook lead generators. The folks in the final expense department have gained great traction with that. We have a number of marketing folks that can help you with that as well. We're introducing that into the Medicare space. That's coming out really soon. So watch for additional information on that. And we still do offer support for direct mail. It's a proven way of getting in front of folks. And based on production, it can deeply discount your cost in working with one of our approved lead vendors. We have 5 of them now. And we do that in order to make certain that we can support you and watch out for you on a compliance basis as well. We want to make certain that the letters fall in line with the carriers we work with jointly, and that it's still compliant, but still can get you in front of folks to sell something. What we're looking to do is earn your business. We'd like that opportunity across the board. If you've got some contracts with us now and they've been sitting idle or they aren't producing as much as you'd like, let's discuss ways of making them more mutually profitable. And if you haven't, or if you've seen some different things with different carriers that you think would be a profitable and timely and smart addition to your portfolio, let's discuss them and get you the contracting information you need to make an informed decision as to, hey, I want this, and let's move forward quickly. That's up to you. The decision to make a decision is a decision, as an old sales manager of mine said many years ago. And what we're looking for is an opportunity to make certain that the opportunities presented here come into play quickly and can affect your bottom line. You can reach any of us here at Premier through our toll-free number at 1-800-365-8208 or through our website at premiersmi.com. Watch for the follow-up we're going to be sending, including a link to today's recording of the presentation given. And we look forward to visiting with you specifically about this tool, the opportunities you have available with carriers, and how we can work together to make 2020 our most focused year yet. I thank you for coming on the line with us today. We look forward to visiting with you in the near future. And in the meantime, we wish you good selling. Thanks so much. We'll talk to you soon.